Hi, Hanakam. So, welcome to Upgrading Pharma channel. So, today we are going to discuss about cough. Okay, so that is drugs used in the treatment of cough. So, first, what is cough and what are the drugs and what are the types of drugs involved in the treatment of cough? Okay, let's enter into the video. Okay. So first we can discuss about what is cough. Okay, in Tamil it is called as irumal. Okay, so cough is a productive reflex. That is, it is one of the reflex that removes the irritant matter and secretions from the respiratory tract. Okay, so we know that respiratory tract consists of, that is, nose, nostrils, pharynx, trachea, bronchi. Okay, so whenever there is an irritant substance or any other unwanted secretions in this tract causes somewhat irritation in that tract. Okay, that irritation will produces the cough. It could be due to, that is, this irritation is due to the infection. Okay, so any infection or any allergy. So allergy, which means that is a pollen grains or any other dust particles. Pleural diseases, so pleural, which means the layer cover the lungs. Okay, so whenever this layer will be damaged, so it causes the cough. Okay, so and malignancy, so malignancy, which means cancer. Okay, so these are the some factors or some materials which can induce a cough. Okay, so next, that is anti-tussive. Okay, so anti-tussive, which means tussive, which means cough. Okay, anti-tussive, it means the drugs or the agents which are against or used to treat the cough. Okay, that is, it will only provide the symptomatic relief but do not alter the cause. Symptomatic relief, that means it will only suppress or it will only prevent the cough, but it do not alter the causes for the cough. Okay, that means it will does not prevent or does not cure the causes for the cough, only just to give the symptomatic relief. So next we enter into the classification of antitussive. Okay, so antitussive, which means so the drugs which will be provided for the cough treatment. Okay, so what are the classifications? That is mainly four classifications, four types of classification. So first, that is central cough suppressants. Second, that is pharyngeal demulcents. Third, that is expectorants. Fourth, that is mucolytics. Okay, so first, that is central cough suppressants. Okay, central cough suppressants, these are directly act on the brain, that is in cough center in the middle obligata, and suppresses the cough. Okay, so this involves codeine, polcodeine. So both codeine and polcodeine are opioid analog, that is, it will be act on the opioid receptor in the brain and suppress the cough. Okay, noscafine and dextromethorphan, so these are the analog of opium, but it will not directly act on the opioid receptor, but it also act on the opium, that is in a cough center. Okay, so next, that is antihistamines. Okay, antihistamines, that involves the chlorpheniramine, diphenhydramine. So these are the some drugs it will auto provide for the treatment of cough. Okay, so this is the central cough suppressants, so act directly on the cough center and prevent the cough reflexes. Okay, second, that is pharyngeal demulcents. Okay, so it does not have any pharmacological action, so it will only provide the smooth coating over the irritated mucosa in our respiratory tract. Okay, so that involves lozenges, cough drops, lintases, syrups. So these are the some basic formulation that will provide for the cough. Okay, so next, that is expectorants. So expectorants, which means dry from the chest. Okay, so these are the agents used to expel the foreign materials or any other infected or dust particle from the respiratory tract. Okay, so these are direct expectorants and indirect expectorants. So potassium iodide, ammonium chloride, so these are the reflex expectorants. Okay, and guaiacol, balsam of Tolu, Wasaka, so these are the direct expectorants, so directly stimulate the secretions of the respiratory tract fluid, and it will expel the content from the respiratory tract. Okay, so these are the expectorants. So next, that is mucolytics. Okay, so mucolytics is also one of the expectorant that will be, it will break down the sputum. Okay, that is disulfide bond in the sputum, and it will be decreases the viscosity of the mucus, okay, so that it will be easily expelled from the respiratory tract. So these involve acetylcysteine, carbocysteine, bromohexine. So these are the major classifications of the drugs used in the treatment of cough, okay. So let's we discuss about the detail about central cough suppressants and everyone, okay. So in this video we discuss about central cough suppressants. In part 2 video of this video we can discuss about the remaining, okay. First, that is central cough suppressants. So we can also discuss about so drugs that will inhibit the cough reflex by directly suppressing the center, that is cough center in the medulla, and are useful in the symptomatic relief of dry irritant cough, okay. So that is dry irritant cough, which means so it does not have any reflux or any irritant present in that respiratory tract, but there will be a cough, okay. So and that type of cough we can use this central cough suppression. So it will directly act on the cough center and suppress the cough reflexes, okay. So there's a main mechanism of actions. So only partially successful in suppressing cough due to the carinal irritation, okay. So carinal irritation, so this is the only main partially successful in carinal irritation type of cough. Next, that is they are unavailable in treatment of cough due to the pleural diseases, okay. So in case of pleural diseases, so this type of cough suppression does not valid, okay, because it does not useful in that particular case. So it only useful in the dry irritant cough, okay. So cough suppressants are not recommended in young children, particularly those below the age 2, okay. So in case of infants or newborns, so these cough suppressants does not provided, okay, because it have the somewhat central effect, so it will leads to the some difficulties in this, okay. So in central cough suppressants, that is codeine, okay. So codeine is one of the drug, and we can also discuss about the dextromethorphan and noscapine, okay. So first, that is codeine. So codeine, we also know that so codeine is one of the opioid alkaloid, that is it resembles like morphine. So morphine is the one of the analgesic, okay, that is powerful analgesic in its action, okay. So this codeine is one of the opium alkaloid and have the morphine like action. So like morphine, it depresses the cough center, but it less constipating, okay. So like morphine, it also suppress the cough center, but it have the less constipating effect than the morphine, okay. Tolerance is not common and drug dependence is rare, okay. Tolerance, it will be not common, okay. So it will be also drug dependence is rare, okay. So but it is not like that, so drug dependence will be produced, okay. So when you are addicted to the codeine syrup, it will also causes the drug dependence, okay. Dose, so dose of the codeine syrup is that is it is in a Lintus form, 5 ml by mouth, okay. So also used as an analgesic. So we also discuss about, so codeine is like morphine, so morphine is given for the analgesic activity, okay. So 5 ml by mouth, so this is the dose, okay. So it's a syrup or it's a Lintus form, so that is 5 ml by mouth, that is a codeine and dose, okay. So dextromethorphan hydrobromide, okay. So dextromethorphan hydrobromide is a D-isomer of codeine analog methorphan, okay. So methorphan is one of the codeine analog. So in methorphan, D-isomer, that is dextromethorphan, that is in this drug, okay. So however, it does not act through the opioid receptors, okay. So but in case of codeine, it acts through the opioid receptor, but in dextromethorphan, it does not act through the opioid receptor and has no analgesic or sedative property, okay. So because it does not act through the opioid receptor, so it have only the suppression of the cough, okay, but it does not have any analgesic or any additional sedative properties, okay. So actions of dextromethorphan includes acts centrally to alleviate the threshold of coughing, okay. So effective as codeine and much safer, okay. So like codeine, it will produce the action, but compared to codeine, it is much safer one, okay. Hence it is commonly used in the pediatric practice. So pediatric practice, that is the age less than 2. So in children we also use this dextromethorphan syrup. Okay, sometimes causes excitement, irritability and confusion. So these are the some adverse effects of dextromethorphan. Then dose of the dextromethorphan include, that is 10 to 20 mg every 6 to 8 hours. So that is the adult dose. So maximum 120 mg per day, that is the maximum limit. Beyond this limit it will causes some effects. Okay, so it is a drug of abuse. Okay, so like codeine, it is one of the drug of abuse. So that it will causes the addiction, that is drug dependence. That is one of the main disadvantage of the dextromethorphan. Okay, so next, that is noscaffeine. Okay, noscaffeine is one of the opium alkaloid, so belonging to the benzyl isoquinoline group. Okay, so it is also one of the non-opioid acting central cough suppressants. So it's a smooth muscle relaxant like papaverine. Okay, so like papaverine, it is one of the smooth muscle relaxant. Antidepressive action approximately equal to the codeine. Okay, so like codeine, so it also produces the antidepressive actions. So does not produces the constipation or drowsiness. So like dextromethorphan, it does not produces any constipation or drowsiness. Addiction does not occur. So addiction is not occur. Sometimes causes nausea. So this is one of the main adverse effects of noscaffeine, that is nausea. Okay, that is vomiting sensation. So dose, that is 15 to 30 mg, that is 3 to 4 times a day. So there's the dose of noscaffeine. Large doses causes bronchospasm. Okay, so bronchospasm, which means the contraction of the branchial smooth muscles, that is called as bronchospasm, and hypotension. So bronchospasm causes hypotension. So these both are the relevant one. So and due to the histamine release. Okay, so at large doses, so histamines are released, so that it will causes the bronchospasm and hypotension. So histamine will be contract the blood vessels, or it will be swelling the blood vessels. Okay, so that the narrowing of the blood vessels causes the less blood pressure at that area. Okay, so that is the reason why the histamine causes bronchospasm and hypotension. Okay, so these are the some contraindications of the noscaffeine. So note, so there is important note, they are contraindicated in the presence of asthma. So that is bronchospasm and hypotension. Okay, so in case of asthma, it will causes bronchospasm. So not only noscaffeine, so all the central cough suppressants are contraindicated in case of asthma, like codeine, dextromethorphan and noscaffeine, because it is a respiratory suppression, or it acts as a bronchospasm at certain doses. Okay, so this is the main disadvantages of the central cough suppressants. Okay, so in second video we discuss about the remaining drugs, that is expectorant, pharyngeal emulsions and mucolytics. Okay, so I hope so this video useful to understand the drugs used in treatment of cough. Okay, so if you like that video, so click the like button and also share this video to your friends, so they are also watch this video and know that what is cough and what are the treatments. Okay, so if you have any doubts or any notes regarding the B-Pharm, you will also comment in the comment box. Okay, so let's see in the second part of this video. Okay, thank you for watching.